Welcome everyone, and thank you for joining today's event. My name is Megan Macklin, and I serve as a program manager in the Office of Diversity, Equity, and Inclusion, where I manage the Campus Community Book Project. To begin, a couple of housekeeping items for our virtual event. Today's event is being recorded. The recording will be made available on the Book Project website. To protect your privacy, you have the option to rename yourself as participant. This can be done by clicking the participant icon in Zoom, then select More next to your name. We encourage you to turn on your video. It's great, especially for our presenter, to see faces. Please keep yourself muted during the presentation. You are invited to ask questions in the chat during the presentation and question and answer portion. During the question and answer, you also can use the raise hand feature, which you can find at the bottom of the participant menu, or just go for it and unmute yourself to ask a question. The UC Davis Campus Community Book Project promotes dialogue and builds community by encouraging diverse members of the campus and surrounding communities to read the same book and attend related events. The Book Project, the signature initiative out of the Office of Diversity, Equity, and Inclusion since 2002, advances the mission to improve both the campus climate and community relations, to foster diversity, and to promote equity and inclusiveness. Currently in its 19th year, the Book Project in 2020-2021 focuses on the theme of mental health and features graphic memoir Marbles, Mania, Depression, Michelangelo, and Me by Ellen Forney. Our selection and theme are supported by a year-long program of lectures, workshops, book discussions, film screenings, exhibits, performances, and more, which this year will take place virtually. Our program culminates when author Ellen Forney comes to UC Davis on Monday, March 1, 2021 to speak, hopefully in person, at the Mondavi Center for the Performing Arts. For more information about the Book Project program, visit our website where you can find up-to-date event information, registration links, and other resources. We also welcome your involvement, students, staff, faculty, and community members, in selecting the Book Project featured title and in planning our annual program. If you are interested in getting involved with the Book Project, please send us an email or refer to the Book Project website for more information. Before I introduce today's speaker, I noticed during in our registration for today's event that we had a number of folks who are joining us from outside UC Davis. So I invite you, as I give the introduction to our speaker, to please put into chat where you're joining us from. We'd love to hear where you're coming from. And now it is my pleasure to introduce today's speaker, Sergio Aguilar-Gaxiola, who will present on the impact of COVID-19 on Latino mental health. Sergio Aguilar-Gaxiola is Professor of Clinical Internal Medicine at the UC Davis School of Medicine, Founding Director of the UC Davis Health Center for Reducing Health Disparities, and Director of the Community Engagement Program of the UC Davis Clinical Translational Science Center. Dr. Aguilar-Gaxiola is an internationally renowned expert on mental health and ethnic populations. He served as the on-site principal investigator of the Mexican American Prevalence and Services Study, the largest mental health study conducted in the United States on Mexican Americans, and from this study, developed a model of service delivery that increased access to mental health services among the Central Valley's low-income, underserved rural populations. Among Dr. Aguilar-Gaxiola's numerous board and council memberships and chairpersonships, over the last 2 decades, he has held several World Health Organization and Pan American Health Organization advisory board and consulting appointments. He currently is a member of the executive committee of the WHO's World Mental Health Survey Consortium and serves as its coordinator for Latin America. Dr. Aguilar-Gaxiola is a national and international expert on health and mental health comorbidities on diverse populations, whose applied research program seeks to better understand and meet population mental health needs, and to achieve equity in health and mental health disparities in underserved populations. He also develops culturally and linguistically sensitive diagnostic mental health measures and translates mental health research into practical information for consumers and their families, health professionals, service administrators, and policymakers. Dr. Aguilar-Gaxiola recently received the prestigious Otley Award, the highest honor granted by the Mexican government to individuals who have dedicated their lives to improving the well-being of Mexicans, Mexican Americans, and other Latinos abroad for his work in advocating for the rights of Mexican nationals in the United States. Dr. Aguilar-Gaxiola, it's my pleasure to welcome you today.
Well, thank you so much, Megan, for that very kind introduction. And it is truly my pleasure to be a part of this series and have the opportunity to share some thoughts on this very topic that you see on the screen. And what I'll be talking about today is the impact of COVID-19 on the mental health of Latinos, which is a topic that I have been following since COVID-19 started, actually. And it is just remarkable how things have evolved since, you know, certainly when I started to be confined at home along with my wife. Today, actually, no, yesterday, it was 7 months ago. So let me get started. This is going to be kind of a little tour or a brief tour of how things are playing out and evolving since, not necessarily since COVID-19 started to unravel, but how things have been emerging up until basically today. So I'm gonna get started with this article from the New York Times back in July 5th. And I'm sharing this information with you because I think that this particular article was a very important article that you know, took a specific look at the racial inequities of coronavirus. And a quote directly from this article states that Latino and African-American residents are 3 times as likely to become infected by the coronavirus as white residents, and nearly twice as likely to die. And further, and I'm, you know, I'm still realizing, and something that I already knew, that the coronavirus has shed some light on structural inequities that have existed for decades. You know, so the quote is that these inequities pointed to the pervasive social and structural inequities that are disproportionately burdening racial and ethnic minority groups with the coronavirus worst effects. And there is this other piece that I wanted to share with you. And back in, you know, in about June, and you see the steep increases in both Latino and Blacks, except that in the case of Blacks, there was a plateauing that was happening, whereas in Latino, there was still some increases in terms of cases. And you know, cases often translate into deaths as well. And I'm gonna be speaking about that in just a few minutes. So this headline, you know, many Latinos couldn't stay home. Now virus cases are soaring in their communities. What we have come to realize through these months is that in the case of both Latinos and African Americans and other groups, you know, Pacific Islanders and Native Americans, is that, you know, a good proportion, at least of Latinos and African Americans work as essential workers. And you know, they don't have the luxury, actually, a good proportion of this, of Latinos to stay home, and they have to go and work in works that, you know, as I will discuss a little bit more, put them at high risk, not only to contract coronavirus, but also to spread it as well. So just to give you a sense of how that started to play out, you know, this is in the same, actually, the same article, that if you consider, you know, places in which there are few Latinos which is the lighter color here, versus many Latinos in places in which Latinos are concentrated. The number of cases took off actually around the middle of June. So just keep that in mind. Here in California, David Hayes Bautista, Dr. Hayes Bautista from UCLA, has been producing this series of reports on how things are playing out primarily with Latinos. And what he chose in this graph, as you can see here, that in a time period of about a month and a half, there was a significant increase of number of cases in Latinos compared to the other groups that you see on the graph. It is almost double in the case of whites and black. The other thing that I want to really share with you, because this has been remarkable, is that if you consider not only the number of cases and deaths by race and ethnicity, but by age groups as well, there is a story that the LA Times actually came up with, and that's when the California Department of Public Health started to post this data, breaking down cases, deaths by race and ethnicity, by age groups. And what I'm sharing here with you is that if you consider ages 35 to 49, as you can see right here, and this is back to May 19, the number of deaths in Latinos, it was basically 74% in the California population. And that is a significant increase, almost double of the percentage of Latinos of this age group in California. Also a big disparity between African Americans, which in this age group, which represent about 6% of the California population, and yet their increase was, their representation in number of deaths, it was 9%. So fast forward, about 5 months, and you see that the number of deaths in Latinos continue to climb, continue to increase, okay? And to the point in which, and I don't know if you have it in your radar, that if you consider, once again, ages 35 to 49, 4 of every 5 deaths in California are to Latinos. And I think that it's important to pause and reflect that what is happening in this age group is that this population are a part of the essential workers and work class, that once again, they haven't had any choice of staying home. They have to go and work in order to make a living. So this is, I'm going to skip that one. The thing that I want to emphasize here is that it's important to consider that if we talk about essential workers, that one of the most impacted, actually in California, is the most impacted group, that we need to focus on what is happening to farm workers. And the headline here is that California farm workers are paying a high price. And indeed, not only in number of cases, but there are fatalities as well related to COVID-19. And also that without federal protections, that farm workers are at risk of infection, as they go about harvesting crops. And back at the end of July, Governor Newsom, in the regular press conferences that he gives, he focused a lot of the remarks then on essential workers. And so he was presenting this information that you see here. This is a close-up. And guess what? You know, among the frontline essential workers, farm workers were at the top of being the most impacted. So you have also construction workers, cooks, you know, truck drivers, cashiers, etc. And one of the questions is why? Why is this happening to farm workers and other essential workers? Well, if we consider barriers to engaging communities in COVID-19 initiatives, you have here two lists, one on direct barriers and the other one on indirect barriers. Indirect barriers, what we know is that when it comes down to, you know, populations, vulnerable populations like essential workers, and I'm thinking once again on farm workers, that there has been ineffective communications about COVID-19. You know, the messaging has been, you know, I would say ineffective in many respects. More work has to be done there because I have seen, for example, some messaging in Spanish, which is difficult to understand. Also, misinformation or disinformation about COVID-19. There has been quite a bit of confusion, even chaos in the information that that these populations get. Also, concerns about the safety of the COVID-19 tests. It hasn't been easy for farm workers to find places where they can get tested. I have heard stories of farm workers that have to travel a couple of hours to get tested, and some farm workers that needed to pay out of pocket, you know, very pricey tests. And then the other challenge has been when the farm workers or any worker gets back the results. You know, we now know that results that are over 72 hours, even less than that, are practically useless. You know, so it is very important to have all of those things in mind and to consider them very carefully. The other thing is that you know, fears about providing information about themselves and about the contacts, people that they have been in contact with. You know, we know now that efforts that had been launched on contact tracing here in California, especially with frontline workers and in rural areas, hasn't worked out that well. And there are several reasons for that, but one of them is related to the fears of providing contact information because, and there is a good reason to be fearful with, you know, the concern that that information may be provided or shared with law enforcement. There is also a stigma related to COVID-19 by now. I think that everybody knows about COVID-19. And for essential workers, it means, you know, that you cannot go and work. And it means losing wages, and means that maybe the family may not be able to make ends meet. Some other factors related to the indirect barriers are loss of income, not having sick pay or no child care, having very low insurance, you know, or being underinsured, even having access to the internet has been identified as a challenge. No resources available for isolating themselves. workers, if they get infected at work, they return home and often, in the case of Latinos, I'm thinking about farm workers that come to their homes in which there are several people in the household. And it's almost impossible to quarantine under those circumstances. And there are other reasons that because of the lack of time, I won't be able to go over them. So a question, what can we do? What can be done to address these issues that I just mentioned to you? Well, there are a few public health and policy recommendations, and these are, without too much specificity, but at least I can mention to you some of the things that can potentially be done. One is to engage with communities at the local level early and throughout, this the pandemic, which is very critical to do that, especially the vulnerable groups that require a coordinated, decisive public health response. Another one is to gather timely data on those affected, which is of critical importance. Testing is of critical importance as well, in order to have a sense of how the extent of the spread. Also meaningful engagement, partnership, and trust of communities. Now there is a better sense here in California at the state level about the importance of having tracing workers, like promotoras, for example, that speak the language well, and also they have the cultural backgrounds of the populations that they are there to serve. Also engage communities as partners in addressing in what matters to them. This is of critical importance if solid inroads are to be made in order to engage these populations and help them protect themselves as well. Other things that we might consider is that we need timely data. And what I'm illustrating here is a geomap, using what is called hotspots that allow you to identify within a city. Here in Sacramento, for example, you see the various zip codes, and the more intense the red, then those are zip codes that are the most affected. And this can help us strategize and come up with community-based approaches to prevent the spread through testing, case identification, and contact tracing, and therefore prevent deaths as much as possible. I took this yesterday. This is how things are playing out in Sacramento, the city of Sacramento. And as you can see here, once again, the darker the color, the more number of cases in those specific zip codes. For example, there are 5 zip codes in the city of Sacramento that have, darker, that there are over 900 cases that have been documented in these places. This is a helpful technology, and I think would be great that if all counties are able to do that. The other thing that I want to emphasize is that we need to come up with protections, continue to have protections for farm workers, like providing them with personal protection equipment, masks, hand sanitizers, or access to washing their hands, and also physical distancing. That is so important. And then once again, the realization that in this case, farm workers need to use crowded buses, public transportation, as well as overcrowded housing. I have a colleague, Bill Vega, who sent me this yesterday. And this is a study about how, about projections, to what extent COVID-19 is impacting life expectancy. And what I want to bring to your attention is the life expectancy of Latinos is very, very high. Actually, is the longest expectancy compared to other groups. For example, at birth in Latinos, the life expectancy is almost 82 years. And if you consider expectancy from age 65 on, it is about 21 years approximately. And so this is how the situation has been before COVID-19. If you consider, the estimates or the projections of the most likely scenario, the scenario that we are seeing right now, there is a reduction on the life expectancy from birth of almost 4 years. And from age 65, those of us who are after 65, of at least 2.5 years. If you have the other scenario, like easing scenario, like opening, universally opening the businesses, then you have a difference of even more years lost to the coronavirus. Like in the case of, for example, in Latinos, is over little over 5 years. And think about it. If the average life expectancy is 82 right now or before COVID-19, it would be 77 years, which is a significant reduction in life expectancy. And if you compare with the other groups like African Americans and whites, the longer reduction in years happens, the projection is that is going to happen to Latinos. So what is the impact of COVID-19 on our mental health? I thought that it was so important to share with you a little bit of the background so I can get into the actual topic that I wanted to focus on. I mean, back in May, we already were, seeing at that time major press, like this article on in the Washington Post, that the headline is, "The coronavirus pandemic is pushing America into a mental health crisis." What does that mean? Well, this approaching wave of mental injuries will be met in coming months by a severely broken system. And what they were referring is that when it comes down to being prepared for this mental health crisis, that it has been, anticipated, that there is not enough funding, that the infrastructure is not in place, something that I will speak about a little bit more in a few minutes. I want to share with you something that is, that I have been impressed with, and that is that the Secretary General of the United Nations, Antonio Gutierrez, who used to be a Prime Minister of Portugal, there are reports that he doesn't concern specifically about health-related issues, although that is an important area that the United Nations cover as well. But he was talking early, in this process about the need to take action to address the mental health crisis in the pandemic. And I have two quotes that I want to share with you. This one, "The COVID-19 virus is not only attacking our physical health, it is also increasing psychological suffering. Mental health is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate fully in our communities. And this is another one that touches me actually personally even more. And it reads, even without the pandemic, 1 in 4 of us will suffer a mental health episode during our lifetimes. By the way, the lifetime prevalence of mental illness here in the US is that 1 out of 2 is 50% is going to suffer, or we are going to suffer from one or more mental disorders. It's even more pronounced here in the US. The shocks associated with COVID-19 are now pushing many towards greater fragility and pain. Grief at the loss of loved ones, anxiety at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, uncertainty and fear for the future. Each of these on its own can trigger or deepen distress. Today, many people are suffering several simultaneously. And he highlighted the case of health care workers, that those are among the ones most deeply affected. This quote that really moves me, because for me, when I see the number of deaths and the proportion of deaths, it doesn't just mean the statistic. It means that there are mothers or wives that are widowed now, and kids that are orphaned, or fathers who are also widowed. And, and it really, really has an impact, and an impact that is going to be long-lasting. One thing that I want to emphasize, for example, in this report, that there has been psychological distress in US adults aged 18 years or older. And this is by race and ethnicity. And take a look at that. You know, the group, when you compare blacks and whites, Hispanics tend to be more impacted in terms of psychological distress. The other thing that I want to emphasize is that it's being considered that mental health, the impact of COVID-19 is considered as a disaster. And there are reasons for that. And this quote is, the pandemic had negatively affected the mental health of 50% of adults. In April, texts to a federal emergency mental health line were up 1,000% from the year before. The situation is particularly dire for certain vulnerable groups, such as healthcare workers, COVID-19 patients with severe cases, people who have lost loved ones, who face a significant risk of post-traumatic stress disorder. This is a more recent headline, Young Adults Pandemic Mental Health Risks. And a summary of that particular New York Times article is that the stress level is high, with 41% overall reporting at least one adverse mental or behavioral health condition, with higher percentages among unpaid adult caregivers, essential workers, and Hispanic and Black responders. And look at this. I'm interested. I'm very, very interested for you to pay attention to information such as this. Like, if you consider 18 to 20 years old, that they reported the highest levels of symptoms of anxiety and depression, and a quarter of them said they had seriously considered suicide. This is very high. And this is something that should give us pause in terms of what is it that we can collectively do to address some of, this kind of issues. This other recent study in this prestigious journal, the Journal of the American Medical Association, that reports that symptoms of depression have risen threefold since the pandemic began. And poor mental health is associated with other risk factors for well-being. So our well-being is being definitely impacted. This is a recent survey that the California Healthcare Foundation did, asking, if if people knew someone who had died of COVID-19. And in the report, it is emphasized that 1 in 5 or 20% knows someone who have died. But if you break this down, by race and ethnicity, look at who is reported to be more impacted in terms of knowing someone who was lost. It is almost 30%, of Latinos compared to other groups. African Americans are about the same level, which are, once again, the two racial ethnic groups that had been the most impacted. This very recent article on Cal Matters is important to keep in mind, and the headline is "Mental Health Tsunami Looms. Can California prevent a surge in suicides?" And a quote from there is that we are very concerned about the layering of multiple stressors on the people of California, said Jim Cooler, who is a colleague of mine with whom I have been working, and as well as other colleagues for the last 3 months. And in a minute, I'm going to tell you where is it that we are working on. He describes the current moment as having challenges on top of challenges that we'd never had to face before. One thing is the pandemic, but the other thing is the fires and the air quality that we all here in California, in one way or another, have experienced. Because this is about suicides. We talk already about suicides. This is prior to the pandemic. That if you consider the 10 years, a decade between 2008 to 2017, if you consider the suicide rates by race and ethnicity and by age groups, by gender as well, what you see here is that Latinos at that time, in those 10 years, Latinos have a trend of larger suicide rates, compared to the other groups. And the other one that is absolutely remarkable is that in the cases of ages 0 to 17, there is a significant increase in those 10 years, almost over 80%. One thing that is sobering to think about is that you think, okay, there is a need for services given all of these mental health impacts that I've been talking about. Is it possible for people to have access to care? Well, the data from SAMHSA is not that reassuring. If you consider Hispanics here, as I'm highlighting, and you consider the conditions of co-occurring any mental illness like depression, anxiety, etc., and substance abuse in adults 18 plus, only 7% of those who are suffering from those conditions are receiving any treatment. 93% are not receiving treatment. That is a heck of a treatment gap. And the other thing that I want to mention, this is a survey, a recent survey of the National Council of Behavioral Health. And this is, it has hundreds of organizations across the US. And what the survey showed is that in the 3 months before the survey, and the survey was done in a time period that ended in August, that more Americans sought their services even as these providers lost on average 23% of their annual revenue. So there are less services, providers are getting less resources, less income, although there are reports that several colleagues that are providing psychological services, that they are booked, that they have a lot of requests for treatments. This came up yesterday, and the headline, as you can see, is about mental health and what I want to emphasize here are two things, and is a second wave of devastation is imminent, attributable to mental health consequences of COVID-19. The magnitude of this second wave is likely to overwhelm the already frayed mental health system, leading to access problems, particularly for the most vulnerable persons. And I really like, and that's, this came out yesterday, by the way, is the solutions that these authors, three authors, are providing. It is from increased funding for mental health, widespread screening to identify individuals at highest risk, including suicide risk, availability of primary care clinicians and mental health professionals trained to treat those with prolonged grief, depression, traumatic stress, and substance abuse, and a diligent focus on families and communities to creatively restore the approaches by which they had managed tragedy and loss over generations. So given this scenario, and I'm totally aware that this is a gloomy scenario. I wish to come here and tell you more good news. But there are some good news that I want to share with you in 2 or 3 minutes. So the question is, what can we do to improve our mental health? Well, there are some healthy ways to cope, with stress. And this comes from the CDC, by the way. Things like take breaks from watching, reading, or listening to news stories. Actually, I have done that along with my wife, and it helps because not many news are good news these days, unfortunately. The other thing is to take care of your body, from paying attention to your breathing, stretching, meditating. Try to eat healthy, balanced meals, hoping that there is food, to eat, exercise regularly. Even if you are in a confined place, it is possible to walk, let's say, around the kitchen table or around the home. If you have stairs, then you go up and down the stairs. But what is very important is to be able to exercise. Get plenty of sleep. That is of critical importance. And then avoid excessive alcohol and drug use, because it really complicates matters significantly. And there is data that clearly shows that the increase in alcohol consumption and drug use is on the rise during the pandemic. Make time to unwind is important, and please connect with others. Don't get isolated. I think that is so important that you are in touch with those that love you and those that you love. This comes from a press conference that the California Secretary of Health, Dr. Ghaly, presented at the end of September, about 2 weeks ago. And in that, the Surgeon General, Dr. Nadine Burke-Harris, introduced this resource that I want to share with you. It's called Together for Wellness. It's a website that has lots of resources, and that has been created. Is the the one that I told you that I was going to briefly tell you about. This is done with the Department of Healthcare Services, the Behavioral Health Division, Dr. Jim Cooler, and Dr. Toby Ewing, from the Oversight and Accountability Commission, colleagues from UCLA, as well as many community partners that we have that have reviewed this and provided feedback. It is a website that is available now, and English is titled Together for Wellness. It's a very engaging and interactive website. And this has been done on purpose. And it has many resources, all for free, that can be used. And this is in Spanish as well. If you toggle in the Espanol, you will come up with the Spanish version. Juntos por nuestro bienestar. Please take a look at the website, and I hope that you are able to check it out. This is the last slide, and this is to bring to your attention another good news, and that is that Governor Newsom, this past week, he signed 5 different mental health bills, that will strengthen the response to the mental health crisis that we are already experiencing and that we anticipate is going to be even more pronounced in the weeks and months to come. And in this particular, in this signing of those 5 bills, Governor Newsom is quoted to say, I pledge to put these critical services within reach for more Californians. The bills I'm signing today will help Californians access the behavioral health services they need to recover. These are steps on the right direction, but much more will have to be done. I'm eager to, if you have any questions, to please share those with me. And I'm going to stop here, Megan, and please let me know if there are questions from the audience.
Yes, thank you so much. We had a few questions submitted via email, so I'm going to start with those. The first question, Dr. Aguilar-Gaxiola, you, I think, painted a really compelling image for us about how mental health and mental illness has been on the rise pre-COVID-19, and we can only imagine that it's something that's going to continue to be a major issue moving forward. The question is, what are some of the most common signs to look for with a person who may be struggling with mental health or stress issues?
Yes, it can be either problems related to anxiety, or problems related to depression. The need to, for example, being despondent, isolating, irritable as well. But if you see that someone or yourselves notice that you are on edge, that you are constantly being anxious about, whatever reason, then it is important to consider and to stop and think, what is happening to me? And of course, it depends on whether there is these emotional reactions are, mild versus, situations that are even more complicated, like severe depression, which is a condition that definitely will need professional intervention. I'm seeing one of my colleagues in the audience, Dr. Werbling, who is a psychiatrist from Solano County. Glad to see him participate in this. So it is important to have a sense as to what kind of level of need is required depending upon the problem. If you have doubts, reach out. There are ways in which you can speak with professionals. there are, hotlines available. If you go to the website of Cal Hope, all you have to do is Cal Hope, California, and you will find there. And there are phone numbers there as well. But I would strongly recommend that if you are experiencing yourself some of these manifestations, or someone you know, please don't delay. Okay, it is important that you take steps to get better.
Thank you. You mentioned in your presentation that there's a clear stigma associated among the Latinx population with contracting the coronavirus. Of course, there's stigma as well associated with mental health. Yes. Is the stigma associated with mental health as strong for the Latinx population as it is for other groups? And if so, what can people do to help reduce or eliminate that stigma?
Yeah, that's an excellent question. Thank you for asking that. What I can tell you is that if you consider that one of the big challenges for Latinos, when they are suffering from mental disorders, is to access care. There are significant disparities in terms of accessing care. And once Latinos get into the doors of service, another challenge is to stay in care, okay? There are studies that show that up to 75% of Latinos who make it into services don't return for a second time. And I think that stigma plays an important role. We know that, having these misconceptions about mental illness or feeling ashamed, or the family feeling ashamed, of someone who suffers from depression, is one of the strongest reasons or barriers to seeking help. Okay, I have known persons, who have endured for decades with severe depression, without reaching out for care. And especially in men, I can tell you that there is more reluctance to accept some of the manifestations or the symptoms, and downplaying of saying, no, this is gonna go away, or going out for services, it is out of the question because I'm gonna look weak, or there are several reasons that stay on the way of really getting into services, and it is because stigma. In the Latino community, I remember a poster that was created by the National Institute of Mental Health on a national campaign that they call Real Men, Real Depression, recognizing that for men within the Latino community, it is extremely difficult to reach out and accept that there are problems, and I remember once again the poster that said, en la cultura latina es una cultura de silencio, that there is a culture of silence, that people don't talk about these things. And for example, if there is ideas about, not wanting to exist anymore, thoughts, but behaviors, suicidal behaviors as well, that the family don't talk about those things. When in fact, I think that is very important to be able to open up and address those issues.
Thank you. I think we have time for one final question. I'm going to take one from our chat. Thank you everyone for posing your questions. Dr. Aguilar-Gaxiola, how do the strategies for coping with stress, the strategies that you mentioned, speak to the Latinx community? How culturally can we speak to this community on how to implement those coping strategies?
That's a fantastic question as well. I think that the major pointers that I share about healthy ways of coping, those apply to any culture, truly. I think taking breaks, not isolating ourselves, eat well-balanced meals, exercising, allowing oneself to pay attention to our breathing, even meditating. Maybe it occurs to me as I'm talking that for example, in the Latino community, that parents, mothers especially, it is like, there is no rest for me. I have to be working. I have to be applying, and there is no break for me because I'm compelled to serve, to really care for those who surround me. Well, this is a time to really allow ourselves to be loved, and to be cared for as well. So I hope that you can be receptive when that is the case. But I know that sometimes it is hard. I have heard on many occasions of saying, well, I have a hard time, accepting help now that I need it, because I never have seek help for myself. So just a couple of thoughts about that.
Thank you so much. I see that we're running low on time, so I'm going to wrap up. And I want to thank everyone for joining us today. And thank you especially, Dr. Aguilar-Gaxiola, for your presentation. The recording from today's event will be made available on the Campus Community Book Project website. And on our website, you also can find a calendar of upcoming events. We have about an event every week from now through the end of March. Of particular interest to this group is on Tuesday, October 27th, we'll be hearing from Dr. Pito Yellowlees, who is the Chief Wellness Officer at UC Davis Health, who will also be talking about the impact of COVID-19. I want to thank everyone for joining us again, and we hope to see you at a future event. Bye, everyone.
Thank you so much. Take care.